In this video, we'll describe what is a hiatal hernia. Here's a picture of a normal anatomy. You have the esophagus, which is your swallowing pipe, coming down, becoming your stomach. And this is the diaphragm. It separates your lungs from your abdomen. The diaphragmatic muscles need to be tight against your esophagus. If it is not tight and it opens up, then the stomach goes up into the chest. This is the hiatal hernia. It can compress against the lungs. It can cause compression of your esophagus, resulting in dysphagia or difficulty in swallowing. It can cause early satiety. Food builds up within the stomach, and it can cause chest pressure or upper abdominal pain. When those symptoms occur, it is time to consider hiatal hernia repair. What surgery consists of is 5 small holes on your tummy. When we go in, the first step we do is to pull this stomach back into your abdomen. When your stomach is up in your chest for a long time, there's scar tissue surrounding the entire part of it. So we got to free up this scar tissue to pull the stomach down. The next step is to close the diaphragm. So we have to make these muscles tight again. What that means is, if this is the opening and the esophagus comes through with a lot of space behind it, we'll put stitches to pull the diaphragmatic muscles tight. This is the most important step of the whole procedure. If this diaphragmatic muscle opens up again, you can have the hiatal hernia coming back, and some patients may be symptomatic from it, requiring another surgery to fix the hiatal hernia again. The third step of the procedure is an anti-reflux portion of it. So once the stomach is back down, we want to do something to augment this area so that you don't get reflux coming back up your throat. There are various options to do this anti-reflux procedure. The first portion consists of making a wrap. It can be a 360-degree wrap, which is called a Nissen fundoplication. It can be a 270-degree wrap, which is called a Toupet, or a much looser wrap, a 180-degree wrap, which is called a door fundoplication. The Nissen is when we take this part of the stomach, bring it behind the esophagus, and connect these two to make it into this wrap. The Toupet, similar to a Nissen, is just a little looser. It's 270 degrees around the esophagus. And the door is when we take the anterior portion of the stomach and flip it anterior to the esophagus to make it a 180-degree wrap. The other option is to put a magnetic sphincter around your esophagus just to strengthen this area. So to choose between these choices, we will have to determine how strong your esophagus contraction is. Any sort of pressure in this area will prevent reflux, but it also makes it a little more difficult for food to come down. So the tightness of the wrap will be determined by how strong your esophagus is. That's the essence of a hiatal hernia repair surgery.